So let's start by talking about the role of the kidneys in the body. The kidneys are responsible for removing the waste product that builds up when we break down food. They're also responsible for regulating blood pressure, thirst, urination, and for blood cell production. So they really are an essential and amazing organ. Kidney failure will develop when over 70% of the function of the kidneys has already been lost. Chronic kidney failure is the progressive loss of the kidney's function over time, and it occurs quite commonly in cats over 10. Unfortunately, there is no cure, but this condition can be actively managed by you and your vet, and your cat may go on to live with this condition for months to years. Because of the long-term implications of kidney disease, I recommend you stay in close contact with your vet for regular checkups and testing. This will ensure your cat copes as best as possible with this condition. So what are some of the signs of kidney disease? Well, these may include excessive thirst, excessive urination, vomiting, weight loss, lack of appetite, or a dry, messy coat. In chronic kidney failure, these signs will become progressive and more severe with time. So if you've seen any of these signs in your cat, and especially if they're over 10 years of age, I recommend going and seeing your regular vet. They're going to give your cat a health exam and possibly look to take a blood and urine test at this stage. On the day, they may even order further tests, like a blood pressure reading or even an ultrasound of the kidneys to help diagnose this condition. Treatment for your cat is generally based on lifetime management of dietary modification, medications, and ensuring your cat remains well hydrated with a continuous supply of fresh water. The medications your cat will go on depend on the clinical signs at the time, but will often use a combination of drugs to prevent high blood pressure, reduce and treat nausea and stomach ulceration, but only ever use drugs under the direction of your veterinary surgeon. You may also want to look to start feeding a premium or prescription diet, which is specifically designed for cats with kidney failure. These diets are a little bit different than supermarket foods, and they've got reduced levels of protein, phosphorus and sodium. They can assist the kidneys in functioning correctly and also avoid high blood pressure. You may also wish to encourage the feeding of wet food, as this will help achieve the desired water intake that will dramatically increase in kidney disease. As kidney disease progresses, your cat may need regular stays in hospital for rehydration and also for further testing to see where kidney function is at. After your cat's been diagnosed with chronic renal disease, they'll generally have a maximum lifespan of about 2 years. However, this is variable and it may be shorter depending on how far the condition has progressed before it's diagnosed. As chronic renal failure is a progressive disease, one day you'll be faced with the hard decision of putting your cat to sleep. Whilst this is never an easy time, it needs to be based on the welfare and quality of life of your pet. Your vet will be able to guide you as to when it's the right time to let go. So, from our vets at the Pet Health Club, I hope you found this video and information has given you further insight into kidney disease in cats. Please see your vet for further advice and treatment options tailored to your pet.